Hi, I'm Zsófia Demjén. I'm an associate professor of applied linguistics at the UCL Centre for Applied Linguistics in London. And I'm interested in how people use language to describe their experiences with illness and with healthcare. I always loved language. I would sometimes finish reading a book even if the story wasn't all that compelling. If the language was interesting and beautiful, I always enjoyed that. So then when I went to university, I went and studied management, obviously. And realized, sort of in the second year, realized it wasn't really for me, but finished my undergraduate degree and then retrained as an English language teacher. I went to do a master's degree, and during that master's I took a module on literary linguistics, which is all about understanding linguistic styles of different authors and different periods and different novels. And I was so fascinated by that basically a one-year master's just didn't feel like it was enough. So I decided to do a PhD. And for my PhD thesis, I looked at how the poet Sylvia Plath described different emotional states and mental states in her diaries. And that kind of got me into the health angle because Sylvia Plath had lots of mental health problems throughout her life. That's how that came to be, and I more or less never looked back. So at the moment, a lot of the work that I do focuses on trying to see to what extent the things that we know about language and interaction in sort of everyday contexts might translate to more unusual experiences, such as when people hear voices that other people cannot hear. So for example, when we talk to each other in everyday contexts, we do a lot of work to manage each other's expectations, wants, desires, sensitivities, in order to get stuff done, but also maintain a harmonious relationship. And so there are ways in which we use language to diffuse conflict, for example, in interactions. And one of the things I'm interested in is to see whether those strategies that we use in everyday contexts might be applicable to handling a voice that's distressing, that's aggressive, that nobody else can hear. And one of the striking similarities is between what distressing voices say to the people who hear them and how they say it, and what people who have been charged with, for example, religiously aggravated hate crimes say to their victims and how they do that. So the sort of analogy that I never thought I would sort of see is that thinking about sort of the voices, the distressing voices, basically what they do to the people that hear them would in other contexts potentially be criminal. And that's for me an insight that I wouldn't otherwise have had. Obviously, illness and healthcare is something that affects people and that happens all over the world. And I know a bit about how things work in the UK. I know a lot less, but some about how things work in sort of Central Europe. But really, I mean, the current COVID situation has really brought this to the fore, that what we all do in our local geographical contexts is really not independent from what other people are doing or should be doing. And so for me, the consortium really represents this opportunity to understand more about everyone's local context, because the whole premise is that we all come together and none of us are trying to impose anything on anyone else. We're all sort of seen, rightly or wrongly, we're all sort of seen as experts in our respective areas. And so it's a fundamentally respectful way of understanding each other's educational systems, health systems, local contexts, cultures, but really learning from all of those things, because it's only through really seeing it and becoming involved in what happens in other contexts that we're able to appreciate the value of things and how it's done in practice. We actually need to be listening to each other more. You know, with all this social media, we are all able to talk a lot more, but I'm not sure we've become any better at just sitting back and listening and trying to understand why somebody might be saying what they're saying. Where are they coming from?